Thank you, ma'am. Good morning. Today I'll be presenting a case of BLAU syndrome. So a 10-month-old female baby was born with features of bilateral uveitis, hypopigmented skin lesions, and lethargy. Subsequent workup revealed the possibility of BLAU syndrome or infantile sarcoidosis. The patient was managed with a combination of systemic, topical, as well as surgical management. So in 2012, the child first presented to us at 10 months of age with abdominal distension, recurrent loose stools, progressive skin lesions, swelling of hands and feet since 4 months of age, and failure to gain weight. General examination revealed pallor, edema of both hands and feet, depigmented hair, hypopigmented scaly lesions over the abdomen, forearm, and lower limbs, and oral candidiasis. Ophthalmological examination revealed bilateral anterior uveitis with a festooned pupil, multiple posterior synechiae, and scattered lens opacities in both eyes. We started her on prednisolone eye drops Q3 hourly in both eyes, along with timolol and atropine. Systemically, from pediatric rheumatology, they had started on methotrexate fortnightly 5 mg. In 2017, the cataract in the left eye progressed. The vision in the right eye was 612, vision in the left eye was 636. Along with the progression of cataract, she had an exacerbation of her uveitic activity, so we had managed with adalimumab. After the uveitis was controlled, the cataract surgery was done in the left eye with the PCIOL implantation of plus 20 diopters. Intraoperatively, we found mild pallor, multiple sheathed vessels, and multiple scarred CRA scars. Post-op, after the left eye cataract surgery, was only 618. Post-operatively, OCT macula was done and showed a shallow sensory neural detachment in the left eye. In 2020, till 2020, the shallow SND was persistent. The parents were counseled for intravitreal injection of Ozurdex, but they were not willing in the beginning. So we tried to step up the immunosuppression. Pulse IV methylprednisolone was tried, but the detachment remained the same and vision remained the same. Finally, they agreed and underwent Ozurdex, but still, despite the Ozurdex, the persistent SND was persistent. In 2021, she developed high IOP and open angles, no inflammation, and which was in the left eye, which was uncontrolled despite maximum AGMs. So she underwent a TRAB in the left eye. Post-op IOP was controlled, but vision was just the same with the SND persistent. In 2022, the right eye had a BSK with a festooned pupil and cataract with vision of 618. In the left eye, it was status post-TRAB and status post-cataract surgery with the shallow SND still persistent. Vision now dropped to 3/60. So in 2023, this is a color fundus photograph. The right eye showed peripapillary atrophy, attenuated vessels with sheathing, macular scar, and multiple CRA patches. The left eye had a hazy view. There was a pale disc with mild blurring of margins, attenuated vessels, and shallow retinal detachment. The investigations that were done in 2013 was CBC showed a microcytic hypochromic anemia. Skin biopsy showed granulomas with Langerhans giant cells. Liver biopsy showed granulomatous inflammation with Schwann bodies. Stool was positive for occult blood. Endoscopy showed granulomatous duodenitis. And colon biopsy showed granulomatous colitis. However, NOD2 gene mutation was negative. So we were debating whether it could be BLAU versus infantile sarcoidosis. In 2023, that was during the last visit, this is the OCT showing the shallow sensory neural detachment still persistent. So I'm just going through the interventions again. Initially, when she had come, we had given methotrexate and mycophenolate mofetil and topical steroids. Then in 2012, that was in 2012. Then 2017, we added adalimumab, and she underwent left eye cataract surgery. Then 2020, Ozurdex was tried for the SND. 2021, TRAB was done. 2020, she underwent right eye cataract surgery and left eye pars plana vitrectomy with silicone oil. And she also underwent diode CPC from outside. So the outcome in 2023, in the right eye was PCIOL with BSK and festooned pupil. The left eye was status post cataract surgery, status post TRAB with a flat vascularized bleb, and status post pars plana vitrectomy with silicone oil in situ. So this was the last follow-up in December 2023. The left eye vision was now hand movements, PL plus PR inaccurate. The guarded visual prognosis was explained to the parents, and we had planned for silicone oil removal at a later date. She is now on brinzotam, homide, and pred. So BLAU syndrome is a rare autoinflammatory granulomatous disorder. It is usually dominantly inherited, but can also be sporadic. Chronic inflammatory syndrome, it has a classic triad, that is granulomatous dermatitis, symmetric arthritis, and recurrent uveitis. And it has striking similarities with early onset sarcoidosis. Most patients with EOS also have mutations in the CARD15 or NOD2 gene. Therefore, some authors are saying that BLAU syndrome and EOS are the familial and sporadic forms of the same disease. And it is the only autoinflammatory disease with a gain of function mutation to show granulomatous inflammation. The first step of therapy, of course, is corticosteroids, and successfully, if there is no satisfactory response, additional treatment with immunosuppressants can be tried. But the results with biologics like anti-TNF, in this case we use adalimumab, are different, particularly with regards to ocular morbidity. So why I chose this case is because even though it's a rare entity, it is gaining significance as an important cause of pediatric uveitis, especially in very young children. And it is quite underreported in India. The recent creation, they are trying to make an international registry so that we can provide novel insights into the symptomatology and etiology of this genetic disorder. Also, proper family history and genetic counseling is essential, and inter-department collaborative efforts between the rheumatology, pediatric rheumatology, and ophthalm is needed for good outcomes. And yes, thank you.
I think it's a very good presentation, Dr. Archana. And since these rare diseases are now becoming very important in India, so I'll just quickly ask two questions. Was adalimumab continued lifelong, or was it stopped? You said in 2017 it was started.
Yes, ma'am.
It was continued.
It was continued.
Despite that, she had progression.
Yes, ma'am.
And what about the other, like dermatitis and arthritis for her?
Dermatitis was under control, ma'am.
Arthritis was also under control.
It was the uveitis that was.
All right. Any more questions?